You started Ozempic or Mounjaro. The weight is coming off faster than you ever imagined. Your clothes are looser. The scale is moving. You are thrilled. And then someone says, "Have you lost weight in your face? You look different and not entirely in a good way." Or you notice your arms look thinner. Your legs feel weaker. You get tired climbing stairs in a way you never did before. This is Ozempic face. This is GLP-1 related muscle loss, and it is one of the most important conversations happening in medicine right now, and most patients are not having it with their doctors. This is MRCPdoc, internal medicine physician. Today, I am going to explain exactly what is happening to your body on these medications, why it happens, and most importantly, what you can do right now to protect yourself. Because weight loss is only a win if you are losing the right kind of weight. Let's get into it. Part 1. What is Ozempic face? First, let me be clear about something. Ozempic face is not caused by Ozempic directly, it is caused by rapid weight loss. Anytime a person loses a significant amount of weight quickly, the face changes. It always has. We just never had a medication that caused such rapid weight loss in so many people simultaneously, so we never had a name for it before. Here's what happens. Your face contains fat, not the kind of fat you think of when you think about weight loss, not belly fat or thigh fat. Facial fat is structural fat. It sits beneath your skin and gives your face its volume, its contours, its youthfulness. When you lose weight rapidly, your body does not selectively remove fat from your abdomen first and leave your face alone. It removes fat from everywhere, including your face. The result is a hollowing of the cheeks, deeper nasolabial folds, the lines from your nose to the corners of your mouth, a more defined, sometimes gaunt, jawline, loose skin where volume used to be. Rapid weight loss also accelerates the normal aging process in the face. Skin that has been stretched by fat does not always snap back immediately, particularly in older patients or those with reduced skin elasticity. This is not dangerous. It is not a medical emergency, but it is real and it matters to people, and dismissing it as vanity misses the point entirely. Body image and self-confidence are part of health. They deserve to be taken seriously. Part 2, the bigger concern, muscle loss. Now I want to talk about something more clinically significant than facial changes, something that has real long-term health consequences. Muscle loss on GLP-1 medications. When you lose weight, you never lose pure fat. You always lose a combination of fat and muscle. This is true for every weight loss method: diet, exercise, surgery, medication. The question is always, what is the ratio? Ideally, you want to lose mostly fat and preserve as much muscle as possible. In the clinical trials for semaglutide and tirzepatide, the weight loss was remarkable, but analyses of body composition showed that a significant proportion of the weight lost was lean mass, meaning muscle. In the STEP trials for semaglutide, approximately 39% of weight lost was lean mass. In the SURMOUNT trials for tirzepatide, the lean mass loss was somewhat lower, around 25%, thought to be due to the additional GIP receptor action, but it was still present. To put this in plain English, if you lose 20 kilograms on Ozempic, roughly 8 kilograms of that could be muscle, not fat, muscle. And this matters enormously. Here is why. Part 3. Why muscle matters so much. Muscle is not just about how you look or how strong you feel. Muscle is a metabolic organ. It is one of the most important organs in your body for long-term health. Here is what your muscles do that most people never think about. Muscle regulates your blood sugar. Muscle tissue is the primary site of glucose uptake after meals. When you eat, your muscles absorb glucose from your bloodstream, lowering your blood sugar. Less muscle means less glucose uptake, which means higher blood sugar, which means worsening insulin resistance over time. Here is the cruel irony. You take Ozempic to improve your blood sugar and lose weight, but if you lose significant muscle in the process, you may be undermining your long-term metabolic health. This is not a reason not to take these medications. The net benefit is still enormous, but it is a reason to actively protect your muscle while you take them. Muscle protects your joints. Every kilogram of muscle around your knees reduces the load on your knee joint. Losing muscle while losing weight can leave your joints more vulnerable, not less. Muscle keeps you strong as you age. After the age of 30, we naturally lose muscle at a rate of approximately 3 to 5% per decade. This process is called sarcopenia. Accelerating that loss through rapid weight loss without active countermeasures can significantly impact your quality of life, your balance, your independence, and your risk of falls as you get older. Muscle affects your resting metabolism. Muscle burns calories at rest. Fat does not. The more muscle you have, the higher your resting metabolic rate. Losing muscle slows your metabolism, making it harder to maintain weight loss in the long term. And contributing to weight regain if the medication is stopped. Part 4. Why does muscle loss happen on these medications? To understand why, you need to understand how GLP-1 medications cause weight loss. The primary mechanism is appetite suppression. You simply want to eat less, much less. Patients commonly report eating half or less of what they used to eat, with no effort or hunger. The problem is that when you dramatically reduce your food intake, you also dramatically reduce your protein intake, and protein is the raw material your body needs to maintain and build muscle. Without adequate protein, your body breaks down muscle to use as energy and to meet its protein needs. This is called catabolism, and it is exactly what happens when food intake drops sharply, as it does on GLP-1 medications. This is not unique to Ozempic. This happens with any very low-calorie diet. The medication simply makes the calorie restriction effortless, and in doing so, removes the natural feedback that would otherwise prompt you to eat enough protein. Part 5. What you can do right now. Here is the good news. Muscle loss on GLP-1 medications is not inevitable. It is largely preventable with the right strategy, and the strategy is not complicated. Number 1, protein, protein, protein. This is the single most important thing you can do. Current evidence suggests that patients on GLP-1 medications should aim for a minimum of 1.2 grams of protein per kilogram of body weight per day. Some experts recommend up to 1.6 grams per kilogram, particularly for older patients or those doing resistance exercise. To put this in practical terms, a 80-kilogram person should be eating between 96 and 128 grams of protein every single day. Given that these medications significantly reduce appetite, getting this amount of protein requires deliberate planning. Every meal must be built around protein first. Good protein sources include eggs, chicken, fish, lean beef, Greek yogurt, cottage cheese, lentils, beans, and protein shakes when food intake is very low. When you sit down to eat your protein first before the vegetables, before anything else. This ensures that even if your appetite cuts the meal short, you have already consumed the most important component. Number 2, resistance exercise. Walking is wonderful. Cardio is beneficial, but when it comes to preserving muscle during weight loss, resistance training is irreplaceable. You do not need a gym. You do not need equipment. Bodyweight exercises, squats, lunges, push-ups, resistance bands, done consistently 2 to 3 times per week, provide the stimulus your muscles need to resist breakdown. The combination of adequate protein and regular resistance exercise is the most evidence-based strategy for preserving lean mass during GLP-1 therapy. Studies comparing patients who did and did not exercise while on semaglutide showed significantly better muscle preservation in the exercise group, with similar or better fat loss. Number 3, do not skip meals. When you feel no hunger on these medications, it is tempting to just not eat. Some patients go entire days with minimal food intake. This accelerates muscle loss dramatically. Set alarms if necessary. Eat 3 small protein-rich meals even when you do not feel hungry. Your muscles need consistent amino acid availability throughout the day, not one large meal and then nothing. Number 4, track your body composition, not just your weight. The number on the scale does not tell you whether you are losing fat or muscle. 2 people can lose the same amount of weight, one losing mostly fat, one losing mostly muscle, and the scale looks identical. Ask your doctor about DEXA scanning or bioelectrical impedance analysis to monitor your actual body composition during treatment. If significant muscle loss is occurring, your treatment plan needs to be adjusted. Number 5. Consider creatine supplementation. Creatine monohydrate is one of the most researched supplements in existence. The evidence for its role in preserving muscle mass during caloric restriction is solid. A dose of 3 to 5 grams daily is safe, inexpensive, and well tolerated. Discuss this with your doctor, but the evidence supports its use in this context. Part 6. What your doctor should be monitoring. If you are on Ozempic or Mounjaro, here is what I want you to ask your doctor at every review appointment. Ask about your weight, but also ask about your muscle. Ask them to measure your grip strength, a simple, reliable proxy for overall muscle mass that can be done in any clinic with a dynamometer. Ask about your protein intake. Ask whether you are meeting the recommended targets. Ask about exercise. Ask specifically about resistance training, not just general activity. Ask for body composition monitoring if possible. And if you are experiencing weakness, fatigue disproportionate to your weight loss, difficulty with everyday activities, tell your doctor. Do not assume it is just part of the process. The bottom line, Ozempic and Mounjaro are genuinely remarkable medications. The weight loss they achieve and the cardiovascular and metabolic benefits that come with it are real and significant. But weight loss is only truly beneficial if you are losing fat, not muscle. Ozempic face is a cosmetic concern, muscle loss is a health concern, and both are largely preventable with the right approach. Eat your protein, move your body, resistance train, monitor your composition, not just your weight. You deserve to lose weight and feel stronger, not weaker. And with the right strategy, that is absolutely possible. Knowledge is not fear. Knowledge is power. If this video helped you, please give it a like. Subscribe so you never miss a plain English medical explanation. If you are on Ozempic or Mounjaro, drop a comment below telling me how your journey is going. I read every single one. Share this with someone on these medications who needs to hear this. This is MRCPdoc, internal medicine physician, and I'll see you in the next one.